Recently, I've been consulting occupational therapy more, and in this video, I want to tell you why I started doing that and why I think you should too. One of the big problems with our medical training is that we don't really get a good sense of the differences between physical therapy and occupational therapy. Everybody really knows what physical therapy is. We consult physical therapy on pretty much every patient in the hospital. Physical therapy is going to be more of the gross motor skills, evaluating mobility and walking, whereas occupational therapy is more of the fine motor skills, such as bathing, dressing themselves, brushing their teeth, completing their ADLs, but also very important things that really would benefit our elderly patients as well, such as assessing their safety at home, whether there's rugs that need to be removed to reduce the risk of falls, or helping them manage their own medications or cook. There's really just a big focus on the patient being able to complete their activities of daily living. You'll see that a lot of times there's a pretty big overlap between the two of them. So that's why it gets extra confusing on, which specialty is focusing on what. But after learning and understanding a little bit more of the differences between them, I felt like, we're consulting PT on everybody, but occupational therapy would be so beneficial for all of these patients too. Here's actually a video that I watched by this guy named OT Focus, and it says, the difference between PT and OT and why OT is more important. So I think there is a little bit of a complex with occupational therapists because nobody knows what they do compared to physical therapists. And then also, I get it. As a YouTuber, you kind of make some of these clickbaity titles like this. Sometimes it pits the two people against each other. But I really do think that physical therapy and occupational therapy are both very, very much, what's that term? It's like symbiotic. It's not symbiotic, but basically they're very complementary, right? It's beneficial to get both physical therapy and occupational therapy involved. Here's his justification for why he thinks occupational therapy is important. And I think it's an interesting perspective to consider. So here's what he has to say about this.
This is what kind of drives me crazy about the medical world, is that in the medical world, we're so focused on the diagnosis and we're not focused on the patient. And occupational therapy in its true form is all about putting the patient first and focusing on the patient's needs and their goals and their wants and their desires, so you have better outcomes. Because if you get a patient, if you try to convince them to become more independent and let's work on getting you from point A to point B, let's get you walking. But if the patient doesn't want to or has no desire and they're in a lot of pain and it's like, I don't want to do all this, I'm in so much pain, this is just torture to me, why would I do this? But occupational therapy is like, well, what are your goals, and what do you want to do in life, and where do you want to be in a year from now? And that's why I think OT is so much more important than physical therapy, because we're focusing on what's meaningful and important to the patient.
So yeah, I'm not entirely sure if I agree with the which one is more important than the other. I think both are important and synergistic. That's the word I was looking for. They're basically synergistic. They both improve each other. And then for me as a physician, when I'm consulting physical therapy or occupational therapy, I just feel like I'm able to provide as many resources as possible to the patient. And oftentimes we can get them set up with home health PT and OT. And I just feel like that really helps set them up for success and prevent them from having to come back to the hospital because they get so much more resources at home. By just consulting only PT all the time, I feel like we are kind of losing a little bit of, a very big facet that patients could benefit from. This is in big contrast to, in China, where I have some relatives. One of my grandparents actually recently had a fall, and they didn't have any resources for home health, physical therapy, or occupational therapy. And I feel like as a hospitalist, as an attending who's discharging patients from the hospital, I'm like, wow, this is actually one of the best things that we can provide. Because, medications, that's probably where, our biggest specialty is. But a lot of times the patient's health is, what matters the most to them is completing their ADLs and mobility and things like that, not adding more and more medications. So in this sense, this is one of the biggest interventions that you can do as a physician.
So I've always wanted to just be in front of a lot of doctors and say, what can a physical therapist do that an occupational therapist can't do? And a lot of times you'll hear these questions, well, a physical therapist focuses on walking and steps, and that's so important for the patient to be able to discharge because they have to be able to walk a certain amount of steps to be able to be safe to go home. And I'm like, yeah, that's important, but like, you're missing the point. Like, is the patient able to get out of bed? Are they able to get dressed? Those are the things that they do on a daily routine. Is the patient able to get on and off a toilet? Because most patients end up, like a lot of patients end up in the hospital falling off their toilet or passing out on their toilet. You have to focus on people's daily activities to be able to assess if they're safe to go home. And physical therapy is important, and it's important to be able to get out of bed and walk and increase your strength and endurance. But OT does that. Almost everything that a PT does, an OT does as well, but we make it functional and meaningful to the patient. So that's why I think OT is so much more important, and why I think OTs should try to reclaim their profession. Because I feel like if you look at PT and OT in the medical community, PT is always up here and OT is always down here. And it's always been like that because people don't know what OTs do.
Yeah, and I've watched a couple of this guy's videos, and he really does harp on that fact a lot, but it's so true. People truly do not know what occupational therapy does. And so while I don't totally agree with his stating, okay, OT is so much better than PT kind of mentality, and I don't think he actually truly means that. He's trying to make a YouTube video that people want to be interested in clicking on and things like that. But I do think he makes a compelling argument for why we should involve occupational therapy more, and why we should educate more people on the utility of having occupational therapy involved. Like he was saying, I want to tell all the doctors what occupational therapy does. And I do really appreciate that he's making these YouTube videos to kind of spread this word, because it is important for us to know what they offer, and how they focus so much on ADLs and helping patients achieve the basic activities that they do at home and functions that they need to do at home. I do think that's a very convincing argument for me. I think a lot of times we can also get pigeonholed in this idea of, physical therapy and occupational therapy, only for somebody who had like a recent stroke or something, or some neurologic deficit where we got to rehab their hands or something. That's kind of the viewpoint that I've heard sometimes, like, I only need it for like patients who had a stroke recently or something. But in reality, there are so many other things that occupational therapists can help your patient with, even if they're just kind of our typical medicine patient who's 70 or 80 years old, kind of struggling with managing their medications at home and just has a lot of difficulties taking care of themselves at home. It's very useful to get occupational therapy involved in that case. So anyways, that's the main reason I started consulting occupational therapy more. I feel like it's been very beneficial for my patients, and I also feel like we need to have a better understanding of the similarities and the differences between PT and OT, and kind of spread that word a little bit more. I'm curious to hear what your thoughts are down in the comments below, and let me know if you think you're going to start consulting occupational therapy more. I'll see you in the next video. Thanks again for watching, and peace.